Hi, my name's Joshua. I'm a nurse. I'm about to start a 7 till 7 shift on the ambulance, so let's see what variety of jobs we do today and come along for the ride if you wish. The role's varied. Every job is very different, and I think that's one of the great things about this role. It is so varied, and it really kind of challenges and makes you kind of use your skills and knowledge in ways which is very different from working in a traditional kind of healthcare setting. You have the ability to work with so many varied people, which are all kind of quite good benefits. It's like working with like one big family, really. We've just done our first job of the day. We're back at station now, just replenishing some supplies, but the first job was a 2-year-old boy who's been unwell for a few weeks, had several courses of antibiotics and still not improving, so we've taken him up to the children's emergency department to be seen by one of their paediatric doctors. So we just attended a second patient of the day. She was a lady who presented with chest pain. We assessed her, found that there was no obvious kind of cause from our initial findings, but recommended hospital, given the initial presentation of chest pain, and we couldn't rule out anything more with her heart. Unfortunately, the lady declined and refused to transport to hospital, so we gave her worsening advice and left her at home. So we just attended our third patient of the day. We went to an 82-year-old male who had had a little fall. Initially everything seemed fine once we'd assessed him, got him back up, but unfortunately his mobility was very poor, and he wasn't safe to be left at home for fear of further falls, and we were worried that he might have had a bit of an infection, so we took him up to the hospital and for some further tests, and so that he can receive some physio OT, and just to make sure there's nothing else kind of ongoing that might be kind of affecting his mobility. So we've just attended our fourth patient out on the coast. This was a direct GP admission, so GP had gone out to the patient's home and was concerned in regards to his heart, so had booked him into AMU at the local hospital for further assessment. So that's the end of our 12-hour shift out of Dereham Station today. I hope it's been a very insightful day for you. Thank you for coming along and seeing what we do.